Hello, my name is Ethan Mitchinson, and today we'll be talking about the criminal mind of Hannibal Lecter, who was a former psychiatrist of Lithuanian descent in the Baltimore area, who was a cannibalistic serial killer starring in the 1991 horror thriller Silence of the Lambs. Now, his mode of killing was where he'd get to know his patients personally, uproot all of their trauma, and then proceed to kill them and consume their bodies. And so he was eventually incarcerated in the Baltimore State Hospital for the Criminally Insane by FBI agents. Now, the film was set during a time period where media was fueled by serial killer cases, usually dramatized to boost network viewership. There was increasing awareness regarding gender dysphoria, and there was sexism towards women in uniform, usually leading to the prolonging of the capturing of the main antagonist in the film, right? Due to Agent Claire Sterling not being taken seriously throughout the film whenever she obtained key information. Now, the disorder we will be discussing is antisocial personality disorder, which, according to Psychology 2E, can be described by the lack of regard of other people's rights or feelings, the performing of illegal acts, lying to or conning others, or the exhibition of irritability and aggressiveness towards others. Now, the presence of delinquency in the Baltimore area could have easily influenced Hannibal's thought process, as according to a longitudinal study in Seattle. And his diagnosis by a therapist could have easily been overlooked as a conscious choice of behavior, or rather an excuse for poor behavior rather than genetic predisposition, due to the fact that during the time, psychological disorders were still not easily completely understood. They were looked more as some influence by your partners or some conscious choice rather than having anything to do with genetics entirely. Now, a broad view of ASPD in cultures is that it can go undiagnosed due to patriarchal societies where ASPD is 3 times more prevalent in men than women. However, that behavior can be easily overlooked and excused due to the risk of women speaking out about it. Additionally, there is general violence in poorly developed communities, which can lead to ASPD or mask ASPD entirely. Additionally, political corruption can lead to an undiagnosis of ASPD in government. For example, looking at someone who has exhibited signs of lack of remorse or cheating or conning can easily be just considered the way of approaching government. Now, those with antisocial personality disorder are often looked at as inevitable killers or criminals, which is just not true, although it is more likely to become a killer or criminal with ASPD than someone who does not have ASPD. Now, someone with ASPD cannot undergo therapy or medical assistance is also a stigma attached to the disorder, in that they still can undergo therapy and seek medical help. Additionally, it is also looked at as a made up disorder to excuse poor behavior, which is also just not true. It has genetic factors and also environmental factors that are out of the person's control. Now, the first symptom displayed by Hannibal Lecter is his lack of remorse in rationalizing having hurt another. For example, his asphyxiation of an inmate, Miggs, who flung semen at his eventual friend, FBI trainee Clary Sterling, and in retaliation for his rude behavior and justifying it as retribution for his rude behavior, he proceeded to choke him and then sever his tongue and shove it down his throat. Additionally, towards the end of the film, near Hannibal's escape, he displayed extraordinary irritability and aggressiveness, as displayed by his killing of 2 security guards, in which he handcuffed them to the jail cell and proceeded to gnaw off their faces. Now, a symptom not present in the film is his impulsivity or failure to plan ahead, in which Hannibal shows extreme cunning and plants bodies in order to mislead the FBI agents into thinking he was dead, allowing for him to escape successfully. Now, a proposed treatment plan would be for cognitive behavioral therapy to be coupled with transference focused therapy, right? And if violent behavior continues, then there'd be the prescription of antipsychotic medication or mood stabilizers, with cognitive behavioral therapy being a method to eliminate one's self-deprecating behaviors, involving the focus of a patient's beliefs about themselves and how their behaviors impair social functioning in order to motivate change. Transference will allow the therapist to understand the thought process of the patient at a subconscious level, and mood stabilizers will decrease the likelihood of violent outlashes. Now, some concerns would be the potential drug abuse, the breach of confidentiality by the therapist, or possible outlashes by the patient in response to the treatment. Now, some barriers would be the financial stability in lower income areas could prevent proper treatment, and transference could easily affect the mental health of the therapist. Now, disorder was portrayed relatively accurately, as all of the diagnostic criteria of DSM-5 but one were exhibited by Hannibal Lecter in the film. The portrayal of the symptoms were not too heavily exaggerated for shock factor or dramatization, and overall, it was just relatively accurate. He was not going out of his way just killing anyone he saw. He was calculative, he was cunning, he used his charm to deceive people. Now, how films influence our understanding disorders is that they can be easily romanticized or thought of as cool. For example, most recently, the Jeffrey Dahmer films, you had, after their release, you had on social media dozens of people posting this serial killer who cannibalized and raped young boys, and you had people who had either zero knowledge of or knew completely, but chose to ignore the fact that he was a cold-blooded killer and instead chose to make edits or videos regarding him. Additionally, exaggerated portrayals of disorders can lead to misinformation on the viewer. You might look at someone who would appear to exhibit some disorder, although that just might be some outlier. That might just be their odd behavior. And then you can easily overlook someone who has a behavior as it's not exhibiting some exaggerated symptom, right? Someone with antisocial personality disorder is not going to go around just killing any person he sees. So if you look at someone who exhibits signs of recklessness or impulsivity, you just easily brush it off as you don't think anything is wrong with them. And here are the references. Thank you and goodbye.